How high does your blood pressure need to be to cause a stroke? This isn't just a medical question. It's a life and death issue that millions of people face every single day, often without realizing it. Stroke is one of the leading causes of death and long-term disability in the United States, and elevated blood pressure, also known as hypertension, is the #1 risk factor. But here's the scary part. High blood pressure usually doesn't hurt. There's no warning bell, no chest pain, no shortness of breath. Most people don't know anything is wrong until it's far too late and a stroke has already occurred. In this video, we're going to take a closer look at how high blood pressure silently damages your brain over time and how sudden spikes can lead to devastating strokes. You'll learn what blood pressure numbers are considered dangerous, the difference between systolic and diastolic pressure, and why even slightly elevated readings, if left untreated, can gradually weaken your blood vessels, putting you at risk. We'll also explore why hypertension is known as the silent killer, how stroke symptoms can be recognized early, and, most importantly, what you can start doing today to reduce your risk, whether you're managing high blood pressure now or hoping to prevent it in the future. So stay with us until the end. The next few minutes could arm you with life-saving knowledge to protect your brain, your heart, and your independence. 1. Definitions and causes. To understand how blood pressure can trigger a stroke, we first need to define what high blood pressure, also known as hypertension, actually is. In clinical settings, hypertension is diagnosed when a person's systolic blood pressure, the top number in a reading, consistently reaches 140 millimeters of mercury or higher, and/or the diastolic pressure, the bottom number, is 90 or higher. These measurements reflect the pressure in your arteries when the heart beats and when it rests, respectively. However, blood pressure readings can vary depending on where and how they're measured. When taken at home, for example, a consistent reading of 135/85 is typically considered hypertensive. And when using a 24-hour ambulatory blood pressure monitor, a consistent average of 130/80 or higher is often used as the clinical cutoff for hypertension. The question of whether these thresholds should shift based on age comes up often, especially among older adults. In general, the diagnostic criteria remain the same regardless of age. While some people may have slightly higher or lower baseline blood pressure as they age, large deviations from the norm should not be dismissed as part of getting older. Instead, they often signal a need for closer medical evaluation. Once high blood pressure has been identified, the next concern becomes its consequences, especially the elevated risk of stroke. Stroke is a medical emergency that occurs when blood flow to part of the brain is interrupted or when a blood vessel in the brain bursts, causing bleeding. Both scenarios deprive the brain of oxygen and nutrients, leading to the death of brain cells within minutes. High blood pressure is the single most important modifiable risk factor for stroke, and it contributes to both of the major types, ischemic and hemorrhagic. Ischemic stroke, the more common form, occurs when blood flow is blocked by a clot or a buildup of plaque in a narrowed artery. High blood pressure accelerates the damage to blood vessel linings, making them more susceptible to narrowing and obstruction. Over time, the constant force of elevated pressure can erode the vessel walls, promote atherosclerosis, and increase the likelihood that a clot will form and lodge in one of the arteries supplying the brain. In this way, long-standing hypertension silently sets the stage for a future blockage. Hemorrhagic stroke, though less common, is often more severe and more fatal. It happens when a blood vessel in the brain ruptures, leading to bleeding into the surrounding brain tissue. Chronic high blood pressure weakens the integrity of blood vessels, particularly the smaller ones deep within the brain, such as those in the basal ganglia, thalamus, or brainstem. Over time, these fragile vessels lose their elasticity, and under a sudden spike in pressure, during physical exertion, stress, or even while sleeping, they can burst. The result is immediate bleeding, swelling, and destruction of brain tissue. In both types of stroke, high blood pressure is not merely a contributing factor. It is a direct and powerful cause. What's particularly dangerous is that even moderately elevated blood pressure, levels many people don't consider alarming, can steadily increase the risk over time. Large-scale studies have shown that the risk of stroke begins to rise at systolic levels above 115 milliliters, far below what many people think of as hypertensive. For each incremental rise, especially in systolic pressure, the likelihood of both ischemic and hemorrhagic stroke increases significantly. This risk is compounded by the duration of elevated pressure. In other words, the longer your blood pressure remains high, the more cumulative damage it causes to your vascular system, particularly in the brain. Yet high blood pressure remains one of the most underdiagnosed and undertreated conditions, largely because it rarely causes noticeable symptoms. That's why it's often referred to as the silent killer. People can live for years, even decades, with elevated blood pressure and feel perfectly fine until the moment something goes catastrophically wrong. This deceptive nature leads many to ignore the condition, delay treatment, or stop medication prematurely. Unfortunately, this is a common pattern. Many individuals with high blood pressure begin treatment, but stop once they feel better or once their readings improve, believing the danger has passed. Others may adjust their medication on their own, skip follow-up appointments, or rely on outdated prescriptions without consulting a healthcare provider. Some even share or borrow blood pressure medications from friends or family, thinking that what works for one person will work for another. All of these habits are dangerous and can leave the brain vulnerable to sudden or cumulative damage. Compounding the problem is a widespread belief that high blood pressure is only a concern for older adults. This misconception leads many younger individuals, particularly those in their 30s or 40s, to ignore warning signs or avoid regular checkups. In reality, hypertension can develop silently at any age, and if left untreated, can cause damage that builds up over years. By the time symptoms appear, whether in the form of vision changes, headaches, or a stroke itself, the damage is often already advanced. There are also biological factors that make blood pressure control more difficult in some people. Genetics, hormonal imbalances, kidney disease, and certain medications can all affect how well someone responds to treatment. In older adults, the body's ability to excrete salt can diminish, and levels of hormones like renin and aldosterone may shift, altering how blood pressure is regulated. This means some people may require different combinations of medications or lifestyle changes to achieve the same results. But no matter your age or background, one fact remains consistent. Controlling blood pressure is the single most effective thing you can do to prevent a stroke. Medical experts agree that with consistent monitoring, appropriate medication, and lifestyle changes, like reducing sodium, maintaining a healthy weight, staying active, and managing stress, you can drastically lower your risk. Understanding what high blood pressure is, how it affects your brain, and why it's dangerous is the first step. The next step is recognizing when something is wrong and knowing how to respond. Because when it comes to stroke, every second counts. In the next section, we'll show you exactly how to spot the warning signs of a stroke using the FAST method. You'll learn why immediate action is critical, what first aid steps to take while waiting for emergency help, and what habits might save a life. Not just for yourself, but for your loved ones too. Stay with us. This could be the most important part of the video. 2. Signs and solutions. Understanding how to recognize the warning signs of a stroke and knowing exactly what action to take can profoundly change outcomes. A stroke can strike with little warning, whether triggered by an artery blockage that starves the brain of oxygen, ischemic stroke, or by an unexpected vessel rupture leading to bleeding in the brain, hemorrhagic stroke. The event unfolds rapidly. In those early moments, the difference between disability and recovery, or even life and death, often hinges on what happens in a matter of minutes. Healthcare educators and clinicians rely on the mnemonic FAST to help the public remember the most common signs of stroke: face drooping, arm weakness, speech difficulty, and time to act. Imagine seeing your parents' smile slip to one side, or their arm suddenly drifting when they try to raise it to you, or their words just don't make sense anymore. These aren't fleeting or mild symptoms. They are urgent signals of possible stroke. The mantra "time is brain" encapsulates the idea that with each passing minute, millions of brain cells and the intricate connections they form die in the absence of blood flow. Robust clinical research reinforces the critical importance of early treatment. Data consistently show that patients arriving at hospitals within the first 60 minutes, what clinicians often refer to as the golden hour, fare much better than those treated later. Interventions like clot-dissolving medications, such as IV TPA or mechanical clot removal, thrombectomy, can dramatically improve recovery chances if administered promptly. In fact, stroke centers that deliver treatment within this window report recovery rates nearly double those of delayed cases. Yet despite training and awareness campaigns, fewer than 30% of stroke patients reach the hospital in time, and many even among them miss the door-to-needle target that aims to further shrink treatment delays. These statistics emphasize that recognizing a stroke is just the first step. It must be followed by fast, efficient medical response to make a difference. FAST covers most types of strokes, but not all. Up to 40% of strokes involve the brain's posterior circulation, areas responsible for vision, balance, coordination, and spatial awareness. These strokes often start with dizziness, unsteadiness, or visual symptoms, none of which are included in FAST. To address these overlooked signs, the B-FAST mnemonic was developed, adding balance and eyesight to the existing FAST criteria. This broader frame helps detect subtle posterior circulation strokes sooner. While B-FAST may increase false alarms, the stakes of missing a stroke are so high that its improved sensitivity can be life-saving, especially for strokes that don't present with classic symptoms. Once you recognize symptoms that align with either FAST or B-FAST, acting swiftly is essential, but it must be done wisely. Do not administer medications at home, especially antihypertensives like blood pressure pills. In hemorrhagic strokes, lowering blood pressure prematurely may seem beneficial, but it can worsen outcomes if done without medical oversight. In ischemic strokes, lowering pressure drastically can deprive already distressed brain regions of the limited blood flow they are receiving. Only specialists in a hospital setting, guided by imaging and precise protocols, can make treatment decisions safely and effectively. However, while waiting for emergency help, your actions can still make a life-saving difference. If the person is conscious but in distress, carefully position them on their side with head modestly raised. This helps prevent choking if they vomit. Loosen tight clothing that may restrict breathing or cause discomfort. Monitor their breathing and pulse, and if they lose consciousness and stop breathing, begin CPR immediately if you have the training. It can sustain vital function until medical help arrives. Most critically, record the exact time when symptoms began. This information is paramount in determining eligibility for treatments such as clot-busting medications or mechanical clot retrieval. Some stroke care systems emphasize speed even beyond the so-called golden hour, referring to performance targets like the Platinum 30 minutes or the Platinum 10 minutes, referring to the preferred time from hospital arrival to initiation of treatment. Hospitals and emergency systems are laser-focused on shaving time off every step, from symptom recognition at home to ambulance dispatch, triage, imaging, and treatment initiation. One study even reported excellent outcomes when treatment, especially for severe strokes, was administered within these extremely tight windows. Despite optimal response systems, strokes still occur even in patients who manage their blood pressure carefully and take medications regularly. The reality is that chronic conditions like diabetes, kidney disease, hormonal imbalances, or cardiovascular disease can make blood pressure regulation unpredictable. Systemic factors such as reduced renal function, decreased hormone responsiveness, or arterial stiffness can make conventional medication regimens less effective. These patients benefit from personalized, often multi-stage treatment plans and frequent reassessments by healthcare professionals. That brings us to prevention, the most powerful element in reducing stroke risk. Long-term blood pressure control, achieved through medication compliance, regular monitoring, and healthcare provider collaboration, remains the best defense. But health is not built by medicine alone. Lifestyle strategies magnify prevention. Adhering to dietary patterns like DASH or Mediterranean diets, rich in fruits, vegetables, whole grains, and low in salt, can lower systolic pressure significantly, sometimes by as much as 12 points. Even modest reductions, around 5 million mAh each, have been associated with a third less stroke risk when paired with regular physical activity, stress management, moderate alcohol consumption, and no smoking. Modern health guidelines reinforce aggressive prevention. Daily sodium intake should not exceed 2,300 millimeters and ideally remain under 1,500 millimeters for those at greater risk. Risk calculators play a growing role, letting doctors and patients estimate long-term cardiovascular and stroke risk decades in advance, helping inform earlier treatment decisions, even before hypertension officially develops. Screening blood and hormone markers provides another precision tool, especially for vulnerable populations like pregnant women, seniors, and those with complex health profiles. Importantly, prevention is also shaped by community support. Access to safe parks, neighborhoods conducive to walking, grocery stores stocked with healthy food, and affordable health care all underpin our ability to maintain healthy habits. Households alone cannot bear this responsibility. Infrastructure and policy play huge roles in creating environments where healthy living is possible and sustainable. For families navigating hypertension, practical preparation is essential. Maintain a validated home blood pressure monitor and ensure prescriptions are accurate and up to date. Educate everyone in the home on fast or be fast. Knowing when and how to react can turn panic into protection. In a crisis, a composed, informed responder who promptly calls emergency services, notes symptom timing, and stays with the person can significantly influence a positive outcome. In summary, recognizing stroke signs early, activating emergency response immediately, and choosing prevention wisely form a powerful trifecta of protection. A well-executed sequence, from awareness to action to prevention, not only preserves brain health in the moment, but builds long-term resilience. In the next section, we will confront persistent myths that sabotage care, describe practical strategies for maintaining healthy blood pressure later in life, and explore how to nurture brain vitality for ourselves and those we love into older age. Today, we've explored some of the most vital truths about blood pressure and stroke, how to recognize the warning signs early, which numbers indicate real danger, and why every minute matters when a stroke hits. It's easy to underestimate high blood pressure because it doesn't make you feel sick. There's no headache, no fever, no rash. It's quiet, but make no mistake, high blood pressure is far from harmless. It is one of the leading causes of stroke, heart attack, kidney disease, and cognitive decline. What makes it even more dangerous is that so many people don't realize they're living with it. Or worse, they think that if they feel fine, they must be fine. But stroke doesn't wait for symptoms to warn you. It strikes quickly, often without any prior warning, and the consequences can be life-altering. The encouraging part, stroke is largely preventable. By understanding your numbers, following a simple routine, and staying consistent with medical checkups and treatment, you can dramatically reduce your risk. Simple daily habits, checking your blood pressure, staying active, eating a balanced diet, sleeping well, managing stress, and following your doctor's guidance can go a long way in protecting your brain and heart. Even if you've had high blood pressure for years, it's never too late to start making changes. If this video gave you new insights, if it helped clarify something that confused you, or if it simply reminded you of how important it is to take care of yourself, don't keep it to yourself. Like the video, subscribe to Senior Health Guide, and most importantly, share it with someone you care about. A spouse, a friend, a sibling, someone who might be ignoring their health because they're too busy, too tired, or too unsure of where to start. Here at Senior Health Guide, we believe that staying healthy after 50 doesn't have to be complicated. It just takes knowledge, support, and a few steady steps in the right direction. Our goal is to help you stay independent, alert, and active for as many years as possible, not just adding years to your life, but adding life to your years. And if you're concerned about your blood pressure, don't wait for a crisis to take action. Talk to your doctor. Ask the questions you've been meaning to ask. Get the right treatment plan for your body, your history, and your goals. Because the best health advice is the one that fits you. Thank you for being here with us today. We hope this time together helped you feel more informed and more empowered to take control of your health. Until next time, take care of your heart, protect your brain, and remember, you are your most important investment. We'll see you in the next video.